So how do these cancers present? Lung cancer, for example, most often they do not have any symptoms at all, because you know that the lung is a very large organ. So if you have a small tumor sitting there, it is not going to cause any symptoms at all in most cases. The lung cancer has to present with symptoms. It would be a long standing cough, or there could be cough associated with sputum. There could be blood tinging of the sputum. You might have some kind of a allergic kind of a cough, which is more in the mornings, more during the night. And another thing is you can experience change in voice. There could be weight loss, or in some people there is just a feeling of not being well. They can have exertional dyspnea, or they feel tired easily. So all these signs and symptoms are somewhat soft signs, which can direct you towards saying that there could be something going wrong. So how do we detect these tumors and try to prevent them? Now, as I mentioned before, for smokers, we have a certain guidelines as to when to detect them, when to screen them. But for non-smokers, there are no set guidelines at all as to when we have to detect or screen them. So how do you detect in a scenario like that is, as I mentioned, if you are at a long duration of exposure, or if you have frequent exposure to these risk factors, or if you have had a very long duration of such risks, then it is always better that you go and get yourself screened. Apart from that, if you have a cough or any of the symptoms which I have mentioned, it is always better to go and get yourself screened. And screening, I mean, you can do imaging as simple as a chest x-ray, and just a clinical examination by a physician would also help. And another thing which I mentioned is just that feeling of not being well is also probably a soft sign or a very early sign. So periodic checkup will give you an assurance that there is no other problem. And even in an unfortunate scenario that you end up detecting a small lesion in the lung, that would be detected very early, and tumors detected early are treated and cured almost always.